Hello everyone, I'm Renee Mehrra and welcome to Your Health Matters, our weekly series with healthcare experts providing their deep insights into critical health issues so we can maintain good health. Today we'll be talking about a very important topic. It's Autism Spectrum Disorder, also called just autism. And joining me on this esteemed panel, we have Joel Levine. He's a New York State licensed psychologist for the last 25 years, and he works through many agencies for preschool special education programs and early intervention programs. Thank you so much, Joel, for joining us today. Krupa Desai, she's also New York State licensed bilingual speech and language pathologist. Thank you. Kirti Chandra, she is the CEO and founder of Tiny Tots Therapeutic Resources, as well as a New York State certified bilingual special education teacher.
Thank you.
And we have a mother who has an 11-year-old autistic child, Sujata Setya. Thank you so much for joining us today. It's a very important topic, and the whole issue that we're talking about today is the early intervention. That is so very important, early detection, so that there could be better treatment for this condition. Joe, let me ask you first, how would you define autism spectrum disorder? Because it's a whole spectrum over here. That's why it's called ASD.
Okay, so at its simplest, autism spectrum disorder is basically issues of social communication.
Right.
So we look for three main things when we're looking to see whether a youngster has autism or not. One, we want to see whether or not the child can understand and use words and gestures socially. Two, do they reciprocate socially? Do they give eye contact? Do they use eye gaze? Do they look at the same toy at the same time as you do? Do they imitate? The third piece that we look for are what we call odd or repetitive behaviors. Rocking in the chair, spinning in a circle for no apparent reason, tippy-toe walking, hand flapping when excited. They must have all three of those things to be considered autism. Starts early in life, so this is one of the few diagnoses that we can make on youngsters that are underneath 2 years of age. The youngest child I have ever tested for this particular variable is 11 months old, upwards into adulthood. Must block learning in some way. That is your technical definition of an autism spectrum disorder. And then there are levels. Mild, moderate, severe. So but to be mild, moderate, or severe, to be on this spectrum somewhere, you must show all three of these pieces.
Now, when you said mild, medium, it can get severe. Can in the same child, from early childhood, as the child progresses, can it become severe as well?
Without treatment, it can. In my experience, once we make a diagnostic statement and we give the child help, the tendency is for the child to move better.
So Krupa, Joel mentioned that, it's a developmental disorder. It happens early childhood. It can happen even like when he said 13 months. And it impacts communication and interaction, behavior interaction. So talk about the evaluation process.
For me, typically the kids come are referred for a speech language evaluation because the first thing that kind of alarms the parent or teacher, depending upon what age they are, is the kid's not talking. So the evaluation varies depending upon at what age they're coming to me for a speech language evaluation. Usually we see a lot of 2.5-year-olds is when the parents kind of start realizing that, oh, the kid's not talking, he's 2.5. A lot of times they do come in late also, around 3.5, 4, sometimes even after they go to preschool. So the evaluation, it changes. It's kind of, we look for different areas. We look for cognitive, play, receptive, expressive. So depending upon what age, if the kid is say 2-year-old, I go in and we start like, okay, it's a lot. We start with a parent interview, and then it's formal and informal evaluation. We play with the kid. We try to see, is the kid following directions? Is he responding? Is he responding to his name? Is he giving me an eye contact? How is he communicating with his caregivers for his needs and desires? So we spend about an hour, sometimes a little longer than that, doing the evaluation. And as we get deeper and into the evaluation, we see, oh, the kid's not related. He's not aware about the environment. He doesn't know if I'm there or not. When I'm pointing to something, can you get me that? He's not looking at that object. And that's the first few alerting red flags that kind of trigger, or kind of that we refer the kid for a psychological evaluation.
So we're talking receptive and expressive. That's what he's talking. So
Right.
the kid is receptive to what you're talking about and expressing.
Receptive in the sense, like if I'm asking, can you get your shoes for me? And if the kid...
But we're talking about like a 2-year-old.
Yeah, a 2-year-old, typically a typical 2-year-old, we expect about, I would say, minimum of 40-50 words, and should be able to follow routine directions and identify objects in his or her environment. So if when I'm telling him that, can you show us your shoes, or show me your eyes, or bring your ball, if he's not following these simple instructions, and he's not looking at, when I tell him, oh, can you get me that? And if he's not looking at the object that I'm pointing to, that for me is my first sign, because he does not have the joint attention. And joint attention typically is a 9-month-old skill. So if a 1.5, 2-year-old does not have that, is that he's not connecting with the speaker. That's
So
the
eye
biggest
contact?
missing. It's different. Eye contact is, I've seen on a lot of kids, it's fleeting. They'll kind of give it to you for 2 seconds. For me, they're not able to maintain the eye contact, because when they say it's lack of eye contact, sometimes a kid is shy, he's not in a mood, so you won't give eye contact. So it's usually fleeting, but for me, my biggest thing is not responding to name, lack of joint attention, and they're not pointing for if they want something.
It's important to note that a lot of these skills start developing in the 6 to 9 month old range.
Right.
That's what allows us to evaluate a 12-month-old for some of these deficiencies, is that children at 6 to 9 months, when you call their name, they look up. If you point in a general direction, they follow. If you try to show them something, they're going to look at the same toy at the same time, which again is that joint attention. Yeah. That's what allows us to evaluate so early, is that these are very early developing skills. I mean, think about when a parent feeds a baby. They're usually holding a baby like this, and the head is here, and the bottle's here, and there is eye contact developing, even in a 3 to 6 month old that doesn't yet have 20/20 vision.
Right.
They're still relating to face.
It's the eye that they're looking at. Sometimes when I say it's a lot of parents are like, oh no, they do look at the face. They're not giving you the eye contact like right now that we're having. They're looking at the nose, they're looking here, and they're just looking at the face is not eye contact.
We'll take a quick break, and when we come back, we'll be talking to Kirti Chandra about the importance of early intervention. We're back, and we're talking on autism spectrum disorder with Joel Levine, Krupa Desai, Kirti Chandra, and Sujata Setya. Kirti Chandra, I wanted to talk to you about the importance of early intervention, because that's how we're going to get early detection and proper treatment. And I know that Krupa and Joel talked about the evaluation process. So tell us, how early is early when we talk about early intervention?
How early is around like 12 months, 13 months, you start seeing those signs, right? Most of the parents are in denial, saying, oh no, because I haven't taught the child, so the child doesn't know about it. When
Yeah,
we
that's
go for
important. That's important when
Yeah.
you're talking about the parents being in denial. And I want to bring
Yes.
this to with our viewers over here, because many times the treatment gets delayed because the parent thinks that this is okay, just something.
The reason they give
It's gonna
you
be okay
is that I
afterwards.
have not taught the child, so the child doesn't know about it. Basically, that's when I come in and ask them, have you taught them crying? No, the kids pick up through the environment, so they have to be very much alert about the environment. Mostly what Krupa was talking about, the not engaging part of it, the autism, basically, the first signs that you start looking is the social interaction.
And some of these things are very subtle things.
Yes.
It's hard to see some of these things
Like
if you're
that.
not looking. It's easy. Most parents will tell me, well, I heard my child is not talking. That's easy to see. Looking at eye contact and are they responding to their name? Look, I called their name 7 times and they responded on the 7th time.
Oh, he's very moody. He's very stubborn. Oh, that's why he's not responding. A lot of times we also get that the parents are like, oh, he's such a good kid. He never bothers us. He's never doing this. But that's a problem, because if the kid is not being a kid, it's not something you always have to take positively.
Right, so it's important for the parent to be a good observer as well as looking for all these signs, but then acknowledging that they're actually happening.
Right.
Basically, that's what we are all looking at, and that's what we want to do. We want to help the parents to understand what autism is, start looking for the early signs, start working towards it, be more socially interactive. That's what all we are looking at, and that's what we are all promoting the parents to do also at this point, because autism is such that it has increased so much more times. Like before, we used to talk about autism as 1 in 188. Now the latest CDC report tells us it's 1 in 68,
Yeah.
which is a very alarming number.
It's almost
actually.
an epidemic.
Early intervention is very, very important, in the sense the more earlier you intervene, the better results you're going to get, because you will get to control the behavior of the child. That is what they learn through the teachers. But what we do as an interventionist, that is where we go in. It's not a cookie cutter thing that everything fits for one child, right? So you have to look into the family stuff also, as well as with the child's, what is the child's reaction to certain stuff. And based on, like, I remember one of the child was not able to point out to a burger, right? Because that was the only food picture in there. He's eating roti, how will he find the burger stuff? Fine. We understand those kind of problems there. It's cultural stuff. We understand that also. So that's why, most importantly, with the South Asian community as such, we are trying to do it more bilingually, and we are trying to bring in people who are culturally sensitive and who are looking into these problems through that perspective also.
So आप अपने पेरेंट्स को क्या बताते हैं, मतलब क्या समझाते हैं उनको?
पेरेंट्स को ज़्यादातर आप यही समझाते हैं कि अगर आपका बच्चा बोल नहीं रहा है, आपका बच्चे को आपको लगता है कोई दिक्कतें लग रही है, आप अपने तक नहीं रखो. Go ahead, ask your pediatrician. Concern है, किसी से पूछो. नहीं है, there are so many different organizations right now working in New York City. I can talk about the New York City program. There are plenty of New York City programs around that deal with this kind of issues, right? Which are called developmental delays. आपका primary care physician बता सकता है आपको. If not, then you can call in like agencies like mine, Tiny Tots Therapeutic Resources. You can call in the New York City Early Intervention Program directly. You can call in 311 if you don't understand anything in New York.
But let's say they can also call you.
They can call
whoever's
us.
watching the show, if they
Yes.
want to know अगर उनके बच्चे को autism है, क्या करना है, where to get the resources, how to navigate the system.
If they think that the kid is not, because no, it's only the psychologist
of
and
course.
the neurologist who usually will diagnose. It's if you suspect, if there is some kind of suspicion that because nowadays with all these movies, autism is also being addressed in Bollywood and Hollywood movies and shows. I feel there is more awareness about this. I personally feel a lot of times, and it's very disappointing, that the pediatricians are, and it's more than you believe. It happens more frequent than you would think, that they do delay in referring the kid to the required evaluations, I feel.
I completely agree with that. Like my pediatrician, right in Upper West Side, it's just like, she said, give your child time, give your child space, he'll catch up. You're being very, you're
Anxious,
and you're,
it's okay,
every child is different.
Some pediatrician from their own personal experience, our kid spoke very late, it's fine. The problem is not that the kid is not talking, and every time I go in for the evaluation, I say the part is worrying me more is that the kid is not following and not engaging in these ABCD activities. Talking, if the prereqs to language are there, the building blocks are there, expressive language, the talking, will eventually come.
Right.
It's always when the building blocks are not there is when the problem is.
But again, we have to keep in mind that parents are not necessarily trained in looking
That's
at
right.
all these things. We have a child, there's no directions.
Yeah.
We have to kind of learn
So
as
the
we go.
professional that
So-
is usually the pediatrician if the kid is small, or the teacher are usually, if the parents kind of miss it, the pediatrician and the teachers are the ones who are knowledgeable for this and should be referring much quicker and faster.
This is what I feel.
Absolutely.
If the parent, even if the parent doesn't think about it, that if they think that they don't know anything about it, they should always consult someone or the other.
Yeah.
Because earlier, the way you express your concerns, the better it is for the child. Even if an incidency doubt you have, that okay, there is a little doubt, I'm not sure, go ahead with the evaluations, because evaluations are the only tool that will help you understand
And it
the best
doesn't
about your
hurt.
child's.
Keeping in mind that you don't have to have the pediatrician sign on in order
Right.
to
Well,
do
you can
that.
call
the
one.
main
You
thing.
can still
Exactly.
call if you, as a parent, feel that there's an issue.
There's
you
a
can still
concern,
call
right.
early
Okay.
intervention and have the
That's
child
great.
evaluated.
We'll take a quick break, and when we come back, we'll be talking to Sujata Setya, who will tell us about her narrative as a mother of an 11-year-old autistic child. Stay with us. We're back, and we're talking on Autism Spectrum Disorder, which is a developmental disability which impacts communication of a child. We're talking to Joel Levine, Krupa Desai, Kirti Chandra, and Sujata Setya. Just in the second segment, we talked about that, pediatricians can delay this evaluation process. So what's your take on it, Joel?
Well, pediatricians tend to fall into two camps. Either they are trained in early intervention, and so they know very well what the early intervention program can provide for a parent, and so they will send the child. Or you have that second camp, which I think was our experience, where the pediatrician says, oh, you can wait, it's okay, the child is going to move forward. Pediatricians will not be upset if you decide to refer to early intervention anyway. As the parent, that is your parental right. You have a concern, and it's okay for you to go. Most pediatricians, even if they wanted you to wait, will not be upset if you decide not to.
Now, Jill, as a parent of an autistic child and a licensed psychologist, what went on in your mind? I'm going to talk to Sujata after this. When
Well,
you first, you could have noticed it right on.
As a trained psychologist, looking at my own child, in essence, I am diagnosing my child as I am kind of emoting for the fact that my child is not tracking, quote unquote, typical. So at the time, instead of going through early intervention, since I was a psychologist in early intervention at the time, I had an outside neurologist, in essence, do a double check on myself. And it was the neurologist who diagnosed my youngster as having autism spectrum disorder. This was roughly 2003. So, and at that point, early intervention was kind of in a new phase with respect to all of these therapies that we now 15 years into the future, we are much better at helping families. So, my wife and I had a lot of discussions, and we had a lot of therapists in our home, new friends, if you will. But we really had a lot of help. And that help moved us forward to the point where, in my case, my youngster is no longer diagnosed.
Wonderful. That is great news. That is wonderful. Sujata, you have an 11-year-old son. When you first found out, that your child was autistic, what went on in your mind?
That will fix it. This is completely like it'll be taken care of. I will research it to death, and I will kind of find the cure for it and treatment for it, and this will be taken care of. There is no way in that my son will not be typical in time. That was my reaction.
And you got early treatment?
Yes, I mean his therapies. He was diagnosed with global delay at the age of 9 months, and so therapies were in order like at that early age, but he wasn't formally diagnosed with autism until 18 months he was diagnosed by a neurologist. And even then it didn't make a difference. It was just like, okay, let's get the ball rolling. Let's do whatever it takes to get him back on track.
Many times families go through a lot of emotional turmoil when they find out, when the child has ASD. Do you want to share your thoughts on that?
Yes, I had my mom by my side. She completely came out of her retirement and she was by my side throughout. So that helped me tremendously, especially the first. My son had a lot of other issues, severe sensory issues, visual spatial issues. So he needed a lot of he needed eye therapy and different kind of interventions. So, and again, a lot of therapists coming inside the house. And so it was almost like a setup at home where like a lot of people are in and out. So it's emotionally taxing, no doubt, but like I did have help, and my mom was there 100% by my side. So I had the respite, I had the help, and a lot of parents struggle though. Given a lot of parents that I know here are nuclear families who've recently migrated here, and they don't have the support system that people who are here have.
Support system is very much there. It's just how you just go about it. Like if your child is diagnosed early and you have therapists in place there, obviously you'll get all the support that you need. For families, basically, sometimes what happens with the South Asian family I can talk about, they're in denial that this cannot happen to my child.
Yeah.
And that's when they don't go out to take any support.
Right.
Because they are so ashamed. Either there is a blame game in the family, it's just because of you, or it's just because of you. It's nothing because of any parent, because there's no control over it.
Right.
The parents don't have a control over it for their child to get an ASD, right? So that's where all the problem starts, basically.
Joel talked about, it's genetic,
Yes.
but then environment plays a very big role. And that's what we're talking about, the social support, getting those resources, getting early
Yes.
treatment.
That's so very important. But the families don't come forward to get those support
Right, like
systems.
Sujata
The problem
was-
is they don't come, even though the support system is very much intact and it's all there, the family don't come forward to take that because they are so much in denial.
There's a stigma, they feel that there's a stigma attached to it.
There's a
So
stigma
we're
attached.
talking about destigmatizing this by
Right.
coming out and,
Talking about it, feel free to talk about it. Like it's the same thing, like there is no cure for it. Obviously, there is no blood test or anything for the diagnosis. Where obviously, if there's a blood test, okay, I can find out this is a problem with.
Right.
It's not a disease. It's
Exactly.
not a mental disease.
Yeah.
It's a disability of another kind.
I don't know if you had this experience as a parent, but I
Yeah.
know I did. I had to educate my family on what autism is and what we were talking about in essence. That, my family, my parents, my wife's parents didn't necessarily understand what we were talking about when we said, well, our child is autistic. I find that still is the case, even though we
So-
are 20 years into the
Exactly.
15 years
Sure
into the
is.
future.
I want to talk about the misconceptions.
Yes.
Many times that happen in our community.
It's a bad parent. Sometimes they'll say it's a bad parenting, Obviously, there's no evidence that improper parenting can cause ASD. That's very important to know. It's not that the parents don't do things for their child. Everybody wants to do the best for their child. There's no parent in this world who will say, I don't want to do something for my child. It's something that you can say when things happen, then you say, oh, I didn't do this, or I didn't do that. It's not true most of the time.
It's not environmental at all. If at all, it's genetic or biochemical. Nobody knows what's
I was
causing
going to say,
it.
the research is still out
treat
on
right.
what
Nobody
the,
knows
there
what's
is no
causing
what the
it.
Yeah.
So what I'm
why
saying
do-
is that, you know, the environment should be positive, that it's
Supportive,
conducive and
right,
supportive,
right.
you know, so this way the child is able to
Right.
get this full potential.
Right, like
you know.
Sujata was fortunate enough to have her mom with her. But as Kirti said, support is there, out there. It's about the parents being open to accepting
Yes.
it.
A lot of parents think my kid is mentally challenged, and I want to bring this up too. It's not. That's not.
It's not mentally challenged. When we are
No.
talking about mentally challenged kids, right? There are the few, like it's 1/3 of the part is mentally challenged.
It's
Like
more
you can't
Well,
say,
social, emotional.
Notice though, when I was asked in the beginning, what makes up autism? Nowhere did I mention
Exactly.
thinking skills, because that is not
It's
a
a-
part of the
right.
criteria of autism. Autism is a social communication
Disorder.
problem.
Yes, exactly. So we're really out of time, and we'd like to take quick, final thoughts from each one of you. Why is it so important for early intervention and early detection for ASD? Joel, starting with you.
In order to have the best outcomes and to move children forward, the earlier one looks at autism, the better.
Earlier the better, the prognosis is better. And again, it's never too late, but earlier the better.
yeah, but the prognosis, we can talk about it much because every child is different. There's no such one particular stuff that you can do it for all children. It's not the same thing. Every individual, you have to treat a child as an individual and work towards the goals. That's it.
Yeah, earlier the better. And another thing I'd like to add, is, but you still can't rush development. If a child has a delay, give him time to catch up. Do not rush him. You cannot make him bridge the gap and give intense therapy and say, okay, he'll catch up a couple of years.
And
So
some
you need
ASD
to-
kids are very high functioning kids.
Yes.
They sure
so-
are. There are some which are very
Yeah.
high functioning kids. There are some which
If
are
you
very
hold the
low
potential,
functioning kids.
absolutely. So the final takeaway on this show: early detection, early treatment, interact socially with your child regularly, right from early childhood. That is so very important. I want to thank Joel Levine, Krupa Desai, Kirti Chandra, and Sujata Setya for telling us with their deep insights about autism spectrum disorder. Until next week, I'm Renee Mehrra. Stay healthy, stay positive.